The MOB has become a nexus of change for the healthcare industry, and the knowledge across our panelists today brings diversity and depth to this topic. We have a practitioner, a real estate advisor, a contractor, an architect, and an engineer. Their views provide a continuum of touch points to share with you the impact of healthcare reform on the medical office building, from high-level strategic planning to construction delivery and facility design.
The three key things I think about in day-to-day operations is what it means to be patient-centered, what it means to deliver truly integrated care, and how do we provide the best quality. And when we really deliver on all of that, especially the quality piece, then we can really focus on affordability. Because if you can prevent illness or the development of illness or the worsening of illness, you're ultimately going to save money.
You know, there's no question, obviously, that there's cost pressures on all fronts in healthcare organizations, and design and construction is certainly no exception to that. We're building a hospital down in Temecula, California right now, and the team, all the way down to several of the subcontractors, are highly incentivized to deliver the building in a very cost-effective manner. Well, it was very interesting. The guy that was framing the exterior wall did a time and motion study. They filmed the guys putting the studs up on the exterior wall on the second floor, and then they changed just the orientation of the saw and a few other things and did it on the third floor. And just by changing some simple things, they went from 40 studs an hour to 60. And you know, the message there was, you know, with just simple things, imagine how much waste is really in that process that needs to be wrung out.
Just as real estate people, what we look at is helping the hospitals understand and supporting them as they figure out what their new delivery is going to be, their new delivery model. And it sounds pretty straightforward, but it's difficult because there has to be fundamental change when you talk about doing time motion and watching how you can improve the efficiency of a construction project. That's really what the hospitals are having to go through right now, is figuring out when the patient presents, arrives at the hospital, what happens to that patient and how do you get 20% more efficient and still provide great care and have good outcomes.
Something we've been doing often tied to the lean process is building a whole clinic module or whole nursing unit. Sometimes when you're looking at a single room, the temptation is to make it a little bigger, and pretty soon you got 20 rooms in a row and they're all 1.5 feet longer and you're walking 30 feet more, and you help see the whole thing. If the engineer and the contractor are there at the same time, they can come up with ideas on how to have savings. I mean, maybe if we change this to a modular, we can start repeating this and save money. But I think that integration goes back to the very beginning. I think the most successful projects are where we understand why they're going. You know, why are they building a smaller clinic in South Beaverton as opposed to keep adding on or building a giant one somewhere? And if we can understand that and what the client is trying to do, we can better implement that as opposed to just treating it purely like a commodity of space.
The challenge that we're facing, there's a couple of things that come to mind. First, I think, as Carl mentioned, cost is a big driver still. People want sustainability, they want energy efficiency, but they don't want to sacrifice on the first cost. And the second thing goes back to something that somebody in the audience said earlier, which was when you're looking, what do patients want? They want spaces that are beautiful, and that really goes hand in hand with sustainability. It's about designing beautiful spaces with daylight, with natural ventilation if it's appropriate for the climate. And when you make those types of spaces, people want to come to the building.
I mean, I would argue that really currently our system is all about sick care delivery, and we don't even do a very good job at that. And so what does it really mean to deliver health care? And so that could really completely expand what we think of what belongs under the primary care model. You know, are we thinking about teaching nutrition classes? Do we teach our patients how to cook, how to grocery shop? You know, do we do these classes, take it outside of the medical office building, or do we partner? Should we be building our medical office buildings next to a grocery store so that we can really teach our patients like how to eat healthfully, how to exercise? So I think that's a huge, project down the road, and I think it's exciting when we really try to shift our paradigm of thinking from, again, production versus quality and ultimate health outcomes.
That's a good way to close. So a round of applause for our panelists again.